Hi,
Hi,
how are you?
welcome. We're Ollie.
Audible and clear as well?
Yes, you are. I hope I am as well.
Yes, absolutely fine.
Perfect. Hi, everyone who's joining now. I hope you know today's live is about perinatal mental health, and in a couple of minutes, think we should be good to go. Maybe we'll wait another 30, 40 seconds.
Sure, no problem.
Hi, everyone, just give us a minute and we'll begin.
I love this user's name, Confused Atma. Interesting. Sometimes people are very creative, I guess.
Very creative, yeah.
Yeah,
Not me. I'm very plain. Boring.
Confused Atma. Interesting. Kind of motto of half
Mm.
of the world, but then they chose the names.
Yes, very truthful about themselves.
Yes. Yeah,
Yeah. I think it's past 5 now, so we'll begin with our introductions.
sure.
Those who are watching us, hello and welcome to our live today with Dr. Ruhi Satija. And she's here today to speak and let us know a little bit about perinatal mental health care and the challenges women and their partners or families may over face during this time, and how to go about overcoming it, and how to seek help. Just in general, to introduce this topic, I think I will just to kind of clear the air about this. Perinatal mental health care is actually a major issue, and it affects about 10 to 35% of women around the world, including India. And in India alone, it's about 20% of women who suffer from depression after pregnancy and even during. So this is actually pertaining to the pregnancy. The word perinatal, as obviously Dr. Ruhi will explain to us in much more insight. This, if left treated, can become quite serious and have very significant, long-lasting effects on the woman, the child, and the wider family as well. There are services, obviously, for women to take help from and their partners to support them through this, which is something Dr. Ruhi will be shedding some light on. So, welcome, Dr. Ruhi, to our life today. And I would just like to begin with this question: what is perinatal mental health, and what's the care all about? What does it pertain to? And if you could just shed some light on that and some key issues attached to this phenomenon.
Sure. Thank you for having me, and thank you for choosing this topic as well. Because, yes, the numbers are high, but definitely the practical scenario is quite different from what we read. The numbers are from the studies that we conduct, but on a practical basis or on an OPD basis, what we see is that patients, even if they are suffering, are very reluctant to come to a mental health professional. In fact, psychiatrist is the last person that we see. First, we have, the friends, then we have the family members, then we have all these religious gurus, then Ayurveda, then homeopathy. And when everything fails, that's when they, choose to come to a counselor. Then the counselor will force them to go to a psychiatrist. And that's when, they pick up the phone and call me. So that's, a very long process. If you have gone in numbers, let me give you another, statistics that would make you understand the impact of depression, for example. So there was a study conducted by NIMHANS a few years ago, which says that on an average, a human being, if suffering from depression, takes 8 years to walk the office of psychiatrist. 8 years. So if I have a cold, it
Is that
will
in
be
India?
8 hours. Yes. If it is, something serious, it will be 8 minutes. But if it is depression, it takes 8 years. And now just don't think about what it does to the treatment profile of the patient. Think of what they have been through. Think of the suffering that the person goes through if they have been under depression for 8 years. And another problem that happens is that if they start suffering in younger years, or teenage or early 20s or 30s, it becomes a part of their personality as well. They start believing that this is who I am. Many times people do not come for anxiety issues or depression. They come saying, I don't feel confident, I feel nervous in trying new things. I'm not able to face people. I'm not able to give presentations. Whereas it has nothing to do with their caliber or their confidence. It is pain, anxiety, or depression going on, which gets unrecognized. Right? Now coming to the perinatal aspect, I gave this introduction, so now we understand the impact of perinatal mental health. Now, when we talk about perinatal, of course, it means that whatever happens during pregnancy. Postnatal is after delivery. Okay. Now, when we talk about perinatal mental health, of course, the symptoms are similar. The mother keeps on suffering, but then it is the child, it is the pregnancy, the baby inside also that suffers. Okay. It is a very well-known proof that during pregnancy, whatever the dominant hormones of the mother is, whatever the mental status is, definitely impacts in shaping up the baby. Right? So if a mother is upset, those are the hormones that are going through the blood to the baby and basically forming the nervous system of the baby. So, very commonly we say anxious mothers have anxious baby. Unfortunately, fortunately, it can be used as an awareness point also from the mother, but not everyone will have those resources that I am anxious, so I'll make sure that my child is not. Most commonly what we see is that this biologically gets transferred as well. Okay, so unless you do not heal, it is a very, it is very likely that you will throw your patterns over your baby, because that's what a child sees. And it is a very big misconception that they are babies, they don't know what happens. But if a small baby, even if, I have noticed, for example, I'm a new mom, I have a 1.5-year-old. I noticed this even in my 2 or 3-month-old child, that if I was exhausted or not that responsive, of course, if I am tired and upset, I cannot be as responsive to the baby as not. And I noticed that my baby could pick on that. He could notice that I'm not the same usual on the other days, and today it's a bit different. So that is how sensitive kids are. So any perinatal health issue or postnatal health issue does not come with just one consequence of the patient suffering. The byproduct is, of course, the harm that the baby has to face, and then the repercussions is towards the partner, and then the extended family as well. Also, something that we do not talk about very commonly is postnatal depression in men. So it is very, sometimes people say that, okay, they didn't get pregnant, how are they getting depression? Today, compared to the last generation, for many people, of course, it's not the same everywhere, but the definition of father is changing, right? Today, men are much more involved in the whole process, much more helping with their partners, etc. So this is also a real thing, that the men also go through depression after, their wife has undergone some major event in their life, and pregnancy is one of the difficult phases. It is a beautiful phase, but honestly, it's very exhausting physically, emotionally, as well as mentally. So all of these factors add up to it, and then cause, of course, postnatal depression, perinatal depression are very commonly heard of. But then we have anxiety as well, which can be very, very debilitating for the patient, because when you are anxious, everything feels like gloomy, everything feels like a difficult thing. And then going through something so difficult in their life, which even someone who does not have mental health issues finds difficult, you can only imagine the tragedy or, the trauma that they go through. And then all these biases about not taking medicines, not starting therapy when you are pregnant, add up to it and make it much more difficult for the patient.
Yeah, I think, it all makes sense when you put it like that. And thank you so much for putting, shedding some light to what goes on. It's not just the mother, but the child, the partner, and the family around them also who get affected. So, I mean, I would like to talk in a bit more depth about like who gets affected. Obviously, it's the mother,
Yeah.
facing that, and then the child, like you very well, explained to us, and then it's the partner. But could you tell us, like, in a bit more detail, like how that happens?
Yes. So, for example, let's start with the mother. The common, let's say we start with depression, right? So, the common symptoms are that they feel very, sad, they feel overwhelmed. There is a sense of sadness around it. Crying spells are there. The feeling of inadequacy is a lot of times a mother feel that they are not good enough mothers. I think all mothers go through, but somebody who has had depression, it's another level. Sometimes there's a lot of guilt involved, because they feel that they are not able to provide or be as good of a mother as they wanted to be for the child, or maybe the child deserves a better mother. If it goes extreme, doesn't get recognized and untreated, it leads to other major issues like insomnia anyways is a part of postpartum, or even pregnancy, because of various issues. But then depression adds to it, and if you don't sleep, of course it has its own toll on you. The appetite changes. Sometimes in depression we see that the patient is just not able to eat anything. And of course, if it goes extreme, the point of suicidality comes. So the thoughts of killing themselves, dying. They feel that maybe, it's better that the child doesn't come in this world. They have all these, ideas. And sometimes what happens is, even if it goes extreme, there can be psychotic thoughts as well, where, they have some delusions or hallucinations going on, which of course are not true, right? But then it is very, very true for them, and they sometimes unfortunately act on it, and it can be harmful for the baby as well, right? So these are the symptoms. And of course, if the partner is going through that, in most of the cases, because there is no awareness, the husband or whoever the family members are, they don't understand what the lady is going through. And then many times what I see is that the family members do not bring the patient because they are suffering. They actually bring to put all these complaints that, she just had a baby and she's being lazy, not taking care of the baby. She doesn't want to do anything. All she wants to do is sleep all day. That's not true. That, lethargy, physically not being able to get up from the bed is a symptom of depression, which is taken as that, that she's lazy or she doesn't want to take care of the baby. So it is a very tragic situation. Some of the cases that I see, I feel like so helpless. And many times we see that, especially if they are pregnant, the family is very reluctant towards treatment. They don't want to start medications. And to be honest, if you don't come early and depression has become severe, we have to give medicines. Obviously, we have to keep that in mind, that there is a baby involved, and of course the medications are chosen wisely. The doses are kept to the minimum, which are barely required. Sometimes we don't even think of treating the mother. All we take care of is that let it get through, let the pregnancy terminate and let the baby come out, and then we will see about treating the mother. But at least we need to keep her at least balanced till the time she can have a delivery, because sometimes it can get so bad. I've had cases where literally, like, minutes before delivery, the gynecologist would call me that she's just not letting us deliver. She's so anxious that it is, and it can lead to physiological effects as well. The BP drops, the heart rate increases in anxiety, which makes it even more dangerous for the baby at the time. So such strategies I have seen, and it's very, very devastating to watch. But the worst part of it is that these are easily treatable. Any mental health issues today, the medications that we have or the therapies that we have, they are so effective that if we start on time, we can literally treat them. And just because we have these misconceptions and bias, we don't. So that is a tragic part of having a mental health issue.
Yeah, very correctly said. I mean, it can really be tragic sometimes when, there's like such a dire need of that person requiring support, but, all they can think about is how it's, not, it's a problem to them, and only then will the family members, take a step forward. I mean, with mental health, there's already so much of a taboo, in our country, with like just going for support. Like you said, it takes 8 years on an average for a person to, seek professional help. And just labeling the mother, I think it becomes very easy. So I think that's exactly why I think we need to be talking about things like this, pertaining to specific issues. And such a big thing that is pregnancy obviously is going to affect women, but I think we are speaking now about how it affects people. But would you explain to us, or maybe shed some light on like how it comes about, like how it comes to be, like some factors maybe that leads to this?
Right.
If maybe a person's not already in a depressive state, or if they are, maybe
Right.
both of these.
Understood. Okay. So if you have had a history of depression, or for that matter, any mental health issues, your chances of getting depression and anxiety obviously increases when you become pregnant. Okay. But that does not mean that just because you had depression earlier, you are going to get depressed. That's not true. Okay. I'll explain you with a biological model as well, so people understand it better. Whenever we talk about any mental health issue, we talk about biopsychosocial model, and which is pretty much true for all medical illnesses also. For example, if we take diabetes, right? So we all have heard, right, that diabetes runs in the family, or blood pressure, BP problems or hypertension runs in the family. Similarly, mental health issues can also run in the family because there is a biological basis of it. We have now identified genetic factors which we know that if there is some alteration, there is a higher chance that you would get biologically some mental health disorder. But that's not the whole story. In case of psychological issues or mental health issues, what we see is a biopsychosocial model, which means bio, the genetics part of it, psycho, which is a psychological, which is basically your own personality, the way you see things, the way you perceive things, the way you process things, emotions. Sometimes you have personality disorders where your emotional processing system itself is, dysfunctional. That adds to it. Plus the social factors. So what type of environment you were brought up in, what type of culture, religion, everything adds up to it. When all of these three in some way contribute to it, or otherwise one became really high, that's when, we see that, for example, take it like this. If a score of 5 is required for somebody to get, an illness, these three things are there. So either one of becomes so extreme. So for example, you have a traumatic event in life where you were not biologically that prone, but the trauma was so significant that it added up and contributed for the package to become 5. Or for example, there were social factors that you were a happy kid, you were born fine, but then somehow, the family environment was so toxic that it led to some anxiety or personality issues. So all three of them add up to it. Sometimes one is more extreme than the other, or there can be a combination of all three. That's why, we say that every case is different. So it's a very, very subjective field. Almost mental health issues, for a psychiatrist, it's an art. For a therapist, it's an art to figure out, one depression, I have a list of same symptoms, but every second person will express it, feel it, and, see it very differently. So there is no such thing that, okay, only this much sadness means depression. That's not the case. So it's very, very subjective based on, of course, the experiences of the patient. But then we have the clinical criteria to diagnose depression. But then it adds up like that. It is not like just because, your biology is failed. Like I said, it can be one taking a strong hit, or it can be all three of them combining and causing the problem ultimately. With pregnancy, the biological and, sociological factors add up, because biologically your hormones change, which can contribute to the problem. And of course, the society pressures are almost there. Otherwise, your own personality, where you are concerned or more anxious about, now having a baby and how you'll manage. Some people have these financial issues going on, which add up to that. Then you have, interpersonal issues. Sometimes within the partners, we see that there are a lot of issues that come up with pregnancy. There are intimacy issues, and there are understanding issues. Time management is bad. One partner is working, the other one feels neglected. So multiple, there's a whole plethora of problems that can happen, and with each case it's different, but basically putting it in these three categories: biological, psychological, and sociological, and taking care of all these three leading to this problem.
Great. That was so well explained. And I think it must be a bit more, clear to our viewers and who will watch this in the future, to just take care of everything else, obviously, along with the support that you do get from a professional, but also just taking care of those little things that happen and we may be able to avoid, especially, taking care of someone who's, going through is pregnant and wants that extra care, extra support from, everyone in their circle, I think. Yeah. So I think that support, obviously, we see from partners, families, but I would like to, I would want you to highlight some specialist services that are available to, women or families going through this, challenge, and how they can approach these sort of professionals.
Understood. Okay. So I'll answer this question taking this only in consideration, that what is the level of your illness. So for example, if I talk about depression or anxiety, when the patient comes, we do an assessment. It can be a clinical assessment, or it can be a formal assessment where we have some question answer based test and we assess the level of severity of the problem. Now, based on that, we divide in three categories: mild, moderate, and severe. Okay. So for the mild category, which is basically, it could be just the beginning of depression, or it could be that, there are a little bit of factors that are adding up to the problem. What we do is, in those cases, the first thing that we do is lifestyle modification, checking what are the factors that are leading up to it, and counseling. In most cases, that's more than enough. Okay. But if it is moderate to severe, depending on multiple factors and clinical judgment, the answer is counseling therapy for the individual plus medication. Okay. And if you are pregnant, medications are always the last thing that we start. Sometimes what we do is, for example, if it's too early in the pregnancy, the first trimester, we actually avoid medications, and after that we see whether we add up to it. Okay. Now, adding up to that, sometimes, like I said, there can be interpersonal issues, which is with a partner or with the family members. Sometimes if they are in a joint family, there can be issues like that. At that time, if we see those factors, like I said, biopsychosocial. So in social factors, we see that these are some of the issues that the patient is facing. We do suggest marriage counseling or relationship counseling, where both of them come and, work towards the issues that are happening. Otherwise, we also recommend family therapy sometimes. So all of the family members come, share their concern, and then we try to find some practical solution where the patient gets, of course, individual therapy will continue, where they learn to take care of themselves and learn not to get affected by these external factors. But definitely doing some family therapy sessions, a few of them, getting all of them together and psychoeducating them, explaining them what the problem is and giving them some practical steps is something that we look forward to. Apart from that, because it's pregnancy, we also look into mindfulness and, yoga, where these healthier techniques help them get over these in a much better way. So these are some of the things that we do. But again, I want to enforce this idea that medications are always the last thing that we do. And this is the reason that they don't come to a psychiatrist feeling that, wahan jayenge, the first thing they'll do is that put them on medications. That's absolutely not true. In pregnancy, that is the last resort that we keep. Unless we see that it can be harmful not to give medications, we don't start it.
I see. So obviously that is an option, but that is also something you take care of. If a woman's pregnant, you have to obviously consider her situation and then according to the case. So I mean, again, this taboo is such a big thing in India. Like how often do you see that how many families are willing to take these counseling sessions, and like is there an acceptance once they understand what's going on and what's at the helm of this problem?
Right.
What do you see generally?
Okay. So when it comes to families, I see it's a rarity, to be honest. And that too, I'm telling you, when I'm sitting in a city like Mumbai, where, we expect that there will be larger numbers of acceptance, but it's not the case. India is very, very far behind in that category. In fact, the only change that I see compared to, what my seniors tell me, and since I started the business, the youngsters, the new generation is very open to it. And that's a beautiful thing. They are very self-aware. They know what they need. They know when they are suffering, and they are willing to put in the work. So that's a beautiful thing about this generation. They have a lot of self-awareness. I didn't have it when I was, their age. So that's a beautiful thing. But I see this problem as well. Many times a youngster would come for treatment and the parents just deny it. That's the worst thing that I see. And I have literally treated teenagers where they have been suffering from 7-8 years. I recently completed treatment for she is now 18 years old. So when she became an adult, the next day from her birthday, she came for treatment, because till that time her mother denied her the treatment. And her first suicide attempt was 12, when she was 12. Now imagine that somebody who tried to commit suicide at the age of 12, how much she was suffering then, and she had to wait till become 18, because now she's an adult and she can, go and take treatment. Till that time, the mother didn't support. And do you know how much time it took for her to get better? Imagine somebody suffering from almost 8 years of depression. What do you think would have taken for her to get better? 8 weeks. That's it. That's it. 8th week,
It's all about taking that one step.
Just one. She was on 2 pills when I started. After that, for maintenance, it was 1 pill, and she continued therapy with me. Overall, the treatment was 5 months. By 5th month, I had already stopped her medication, and that's it. And it has already been 6 months, and she's absolutely fine. She's still in touch with me. She comes for some follow up and all, but she's off medication and off therapy. That's all. Imagine 8 years of suffering.
Oh my God, I
at
can't.
her age. Yes, that.
But I mean,
talk about.
it's easy to believe this story. I mean, people are so hesitant for something that they could have chosen not to suffer, or chosen for their child. Obviously, how much autonomy does a child have in these matters? But I guess as parents, again, it's like such a delicate thing. Like, you think it's like, oh, they're just being lazy, or they're being like, oh, they have so much attitude, they need to change.
Yes.
But sometimes it's something else, that's going on under there.
In this case, and this happens with most of the cases where people try to harm themselves or try to commit suicide, the reaction they get is they're only doing it for attention. And that's the worst thing we can do to them. My answer to one of the parents was that she very bluntly told me, she only does it for attention. I was like, if she has to do this for your attention, imagine how desperate she is. Don't you think that itself is a call for help?
a problem. Yeah.
Right? That why does she have to come to this level? Why are you not giving her the attention that she needs in the first place, so that she doesn't have to do any of that? That's a very sad reality. So yes, I see a lot of reluctance, a lot of resistance. In fact, I do therapy sessions as well, and this is how I tell them that if you take medicines, you will be paying me less. You will need less sessions with me because you'll get better much faster. They still don't take it. They're okay with continuing
Whatever.
for
Oh no, my God.
2 to
No,
3
I've
months.
personally heard of,
Yeah.
yeah, a lot of, people just being so apprehensive about taking medication,
True.
because I think somewhere they attach it with like, oh, then it means we have an issue,
Yeah.
a mental health issue, like, oh, hum pagal hai or something.
Right.
Because that's what it's been. That's the narrative here about mental health issues. And, how can a mother then be okay, like, oh, how can we tell, oh, this lady who's pregnant in our house has mental health issues? I mean,
Yeah.
it's about their family, again, the social,
True.
the social part of it, it's all intertwined.
That. Yeah. It's really sad. That's why we have to do more of these and talk about it so that people actually understand that what's happening. Yeah.
Yeah, definitely. I think a lot of tips that you've given us, I hope people, look at this, in an informational way and just go seek the support if that's what they need, or, help someone out in their circle. If they see someone suffering, just, go to them, ask them, let them decide, at least, or just don't label them, I guess, is what I say. I end my lives, I think, with all of these, just saying that, the friends, the circle, I think it's quite important, because you're still seeing it. It's sometimes hard to accept, but if, you get acceptance from outside sometimes that it's okay not to be okay, it becomes easier to take that one step towards, healing, I think, recovery, or whatever it may be that person needs. I think, yeah. So I think we've covered such a deep, I think, topic, and I think you've explained it flawlessly, and thank you so much for giving your insight on this topic, and informing our viewers, and it was amazing to do this collab with you. Thanks again. And now I think we should just wait maybe for a couple minutes. I think the viewers that we do have, in case you guys have any questions, from our end, from our Dr. Ruhi, obviously she'll be happy to answer these, pertaining to obviously perinatal mental health, or in general mental health, if that's something you need. So please feel free to drop this comment, drop a comment here on this live, and I think we can just give it a minute. If not, we can end this live, but you'll still be, please feel free to comment on our live, and we can just have it forwarded to Dr. Ruhi about that as well.
Absolutely. And
all right.
Now, so I think the best thing that happened in COVID for mental health issues was this only, that, so much of things came online, and all the doctors are available, all the therapists are available. In fact, I do 90% of my work online as well. So that gives them the access also, and that, that privacy issue is also gone. I literally tell them that, no, you just need to say that you're talking to a friend, and you can just talk to me for half an hour, and you don't need to tell. Sometimes, I see this, that one person comes and they say the other one doesn't want to come. I said, don't tell them that you're asking them to talk to a psychiatrist. Just say, I am some of your cousin or your friend, and you just want to have a, you just want them to have a chat with me. All these things, and it works. That, I just tell
you have to do it. I think
I am whose friend and all. Just give me some of the backstory if they ask me. Yeah, I do that on a daily basis, because people don't want to come to a psychiatrist, to an unknown one, right? So this is what we do. I tell them that, make me your cousin.
You're very dedicated to help people. Yeah. It's amazing. I think if every mental health professional in India was as dedicated, I think there would be no issue. But unfortunately, there is still, I think, a while for us to be able to think.
The thing is, there is so much work to do. I can do it right now because this is my choice to do a very limited practice. So I give more time to less patients. That's how I feel comfortable in working. But then when I was in my job, I was literally seeing 100 patients a day. So it's not possible to be that committed.
Oh my God.
I literally have seen 100 patients.
In depth, yes. Yeah. See, again, I think that highlights another issue that we have, like the lack of mental health professionals, like the right kind of mental health professionals who are, properly trained and licensed here, and who actually are wanting to help patients and not just keep them as this like, herd that, okay, yeah, these are my client base kind of thing. I think that's so hard to find, and, adds to that taboo that people have.
Yes.
And just
And it's an
everything
actual
negative.
thing. It's an actual thing. Many times people come and tell me that, I've been in therapy for 2 years and, nothing has happened. I always ask them, what is the qualification? And in most cases, there'll be some life coach or some, holistic coaches. And they just do 1 month of
Worse are the
certification.
horoscope,
Yeah, those babas and
people
all.
where,
Yes.
oh my God, no, please do not
Yeah.
go to them.
Yes, they
Oh
go
my God.
there. They
The
go there
number
and
of
then
people who actually believe that they'll get support from there.
Just 2 days
It's
back,
scary.
I got a patient who has spent some 15 lakh rupees on some Ayurvedic therapies for her anxiety, which was told to her that it is some imbalance in her whatever chakras and blah blah. She spent 15 lakh rupees and all she needed was two pills. That's all. Which she was
That's
reluctant.
such a scam of like people's money, energy, and the fact that they can get better.
Time,
It's not
5
even that
years she
hard.
was in that therapy, imagine.
Oh my God.
Yeah.
But at least I think now people, youth like me, people who are younger than me, they're so comfortable just going to the doctor, even if they have to lie to their family for that.
True.
They don't wait for permission. They just go get help. And I think I've seen that so much in my circle, even my cousins who are younger to me, they'll just like deal with their problem. They'll be like, I have this issue, I need to take care of it. No need to involve parents. They're all adults. I think that is something that you mentioned, the youth coming forward and being so open about it. I think it really is, a light, a ray of hope. I think in the circumstances changing, maybe the landscape of mental health changing, I think, in our country. And yeah, makes me a bit happier to do the job.
That's what I'm telling you. The new generation, at least, I have a lot of hopes. So that makes me also feel, a little that, I'm not the only one struggling. And
all of this, it's leading to something good.
Yeah, it is.
It
The
will.
number of messages that I get every day, even on Instagram, are mostly from the youth, and they ask for help and all, and I do as much as I can. So that's a beautiful thing. We are leading to something, but of course, it's a long way to go.
Yes. It is. And I think on this positive note, I think it would be great to end this live, as we don't really have any questions. But please feel free to comment later on the live, guys. Yes, and again, can't thank you enough, Dr. Ruhi. We had some great, conversations, great topics, things we spoke about, such diverse things. I think I, will want to welcome you again for a future live again. Definitely talk about something very meaningful again.
Absolutely.
Until then, see you. Thanks again, everyone who's watching. Dr. Ruhi. Bye-bye.
Thanks, Shreya. She's here. Commented. So
bye, everyone.
Yes.
Thanks all.
Bye-bye.
Bye-bye.